pressure. Today we're going to talk about the pulse pressure as we promised. What is a pulse pressure? Pulse pressure is a difference between your systolic blood pressure and a diastolic blood pressure. Why is it important or relevant is that when you subtract your diastolic from the systolic, that actually tells you your workout capacity. How? I'll tell you. When you are working out, it is expected that the heart will pump faster and stronger. So the pressure generated by the heart is going to go up, so systolic goes up. For any reason, if your heart is not able to generate enough force, the systolic will not rise. At the same time, the increased workout demands more blood supply, so blood vessels dilate. When they dilate, the area opens up more, so the pressure will drop. So diastolic is going down. Now, if your blood vessels fail to dilate, the diastolic will not drop. So wider the pulse pressure indicates that your heart is capable to raise your systolic blood pressure, whereas the blood vessels are dilating enough to receive more blood needed for the workout, so the diastolic blood pressure drops and the difference becomes bigger. So it's wider pulse pressure. Wider pulse pressure indirectly shows an increased capacity to work out. Whereas if the systolic fails to rise but the diastolic or the blood vessels respond in a favorable manner, the diastolic will fall. So the pulse pressure will not be wide enough, but still it is showing an improved thing. Whereas somebody who's old, whose heart is not able to increase the pressure and blood vessels are not flexible enough to dilate, their pulse pressure will narrow down. So that shows as a reduced cardiovascular capacity. Until we meet again.